Cerebral palsy, CP, is a group of neurological disorders that affect movement, balance, and posture. It is caused by damage to the developing brain, usually occurring before or during birth, but it can also happen shortly after birth during early infancy. The brain damage can be a result of various factors, including infections, prenatal complications, genetic disorders, or brain injuries. Cerebral palsy, CP, can be classified into several different types based on the pattern of movement and affected limbs. The classification is primarily based on the severity and distribution of motor impairments. The four main types of cerebral palsy are: Spastic CP. This is the most common type of cerebral palsy, accounting for about 70 to 80% of cases. It is characterized by increased muscle tone, leading to stiff and tense muscles. People with spastic CP may have difficulty relaxing their muscles, making movements jerky and awkward. Spastic CP can affect one side of the body, hemiplegia, both legs, diplegia, all four limbs, quadriplegia, or one arm and one leg on the same side, double hemiplegia. Dyskinetic CP, also known as athetoid or dystonic CP, this type involves difficulty controlling voluntary movements and results in uncontrolled, involuntary movements. Individuals with dyskinetic CP may have fluctuating muscle tone, leading to writhing or twisting movements, making it challenging to maintain a stable posture. Ataxic CP. Ataxic CP is less common and is characterized by problems with balance and coordination. People with ataxic CP may have a wide-based gait and may appear unsteady or shaky when performing fine motor tasks. Mixed CP. Some individuals may exhibit a combination of features from more than one type of cerebral palsy. For instance, a person may have both spastic and dyskinetic features, which is referred to as mixed CP. The symptoms of cerebral palsy can vary widely depending on the type and severity of the condition, as well as the areas of the brain affected. The most common symptoms include abnormal muscle tone. People with cerebral palsy may have muscles that are either too stiff, spasticity, or too floppy, hypotonia. Spasticity leads to stiff, jerky movements, while hypotonia results in reduced muscle strength and control. Delayed motor milestones. Infants with cerebral palsy may show delays in reaching developmental milestones such as rolling over, sitting up, crawling, or walking. Abnormal motor patterns. Individuals with cerebral palsy often display abnormal movement patterns, such as dragging one leg while walking, scissoring gait, or using only one side of the body. Involuntary movements. Some types of cerebral palsy, like dyskinetic CP, can cause uncontrolled or involuntary movements, which may appear as writhing, twisting, or slow, fluid movements. Balance and coordination difficulties. Maintaining balance and coordinating movements may be challenging for people with cerebral palsy, leading to unsteady gait and difficulty with precise motor skills. Speech and communication problems. Cerebral palsy can affect the muscles involved in speech, leading to difficulties in articulation, voice control, and communication. Intellectual and developmental challenges. While cerebral palsy primarily affects movement, it can sometimes be associated with cognitive impairments or developmental delays. However, many individuals with cerebral palsy have average or above-average intelligence. Seizures. Some individuals with cerebral palsy may experience seizures, which are caused by abnormal electrical activity in the brain. Muscle contractures. Over time, spastic muscles that are not properly stretched and exercised may lead to muscle contractures, where the muscles become permanently shortened. Difficulty with fine motor skills. Tasks that require precise movements, such as writing, buttoning clothes, or using utensils, may be challenging for individuals with cerebral palsy. Feeding difficulties. Infants and children with cerebral palsy may have difficulty sucking, chewing, or swallowing. Cerebral palsy, CP, is caused by damage to the developing brain, particularly in areas that control movement, muscle tone, and coordination. The brain damage that leads to cerebral palsy can occur during pregnancy, childbirth, or early infancy. Some of the common causes and risk factors associated with cerebral palsy include prenatal factors. Brain damage can occur before birth due to various prenatal factors, including infections during pregnancy, such as rubella, cytomegalovirus, CMV, or toxoplasmosis. Maternal health conditions like untreated high blood pressure, thyroid disorders, or seizures. Exposure to certain toxins or medications during pregnancy. Insufficient oxygen supply to the baby's brain, hypoxia, due to issues with the placenta or umbilical cord. Genetic or chromosomal abnormalities. Perinatal factors. Brain damage can also occur during the birth process, particularly if there are complications during labor and delivery, such as prolonged labor or difficult delivery, premature birth, preterm birth, or low birth weight. Fetal distress, where the baby experiences a lack of oxygen during labor. Infections acquired around the time of birth. Postnatal factors. In some cases, brain damage leading to cerebral palsy can occur after birth, during early infancy. Postnatal causes may include traumatic brain injuries, such as from accidents, falls, or physical abuse. Severe jaundice, which can lead to a type of brain damage called kernicterus. Infections that affect the brain, such as meningitis or encephalitis. Stroke or bleeding in the brain. The treatment of cerebral palsy, CP, is typically a multidisciplinary approach aimed at improving the individual's quality of life, maximizing functional abilities, and managing associated symptoms and complications. The treatment plan may vary depending on the type and severity of CP and the specific needs of the person. Some common components of CP treatment include physical therapy. Physical therapy is a fundamental part of CP treatment. It focuses on improving mobility, muscle strength, flexibility, and overall motor function. Therapists use exercises, stretching, and other techniques to enhance gross motor skills and help individuals with CP achieve greater independence in their movements. Occupational therapy. Occupational therapy addresses fine motor skills and activities of daily living. Therapists work with individuals to improve skills like self-feeding, dressing, writing, and using utensils. They may also recommend adaptive devices to assist with daily tasks. Speech and language therapy. Speech therapists help individuals with CP improve their communication abilities. This includes working on articulation, language development, and alternative communication methods, example, augmentative and alternative communication devices, for those who have difficulty speaking. Medications. Medications may be prescribed to manage specific symptoms of cerebral palsy, such as muscle spasticity or seizures. Muscle relaxants, antispasmodics, and anticonvulsants are examples of medications that might be used. Orthotic devices. Braces, splints, or orthotic devices can help improve muscle alignment, support weak limbs, and prevent contractures. Assistive devices. Various assistive devices, such as walkers, canes, wheelchairs, or communication aids, may be recommended to enhance mobility and communication. Intrathecal baclofen therapy, ITB. In severe cases of spasticity that do not respond to oral medications, ITB therapy may be considered. It involves the delivery of a muscle relaxant, baclofen, directly into the spinal fluid using a pump. Botulinum toxin injections. Botulinum toxin injections can help reduce localized muscle spasticity and improve mobility in specific areas. Surgery. In some cases, surgical procedures may be performed to correct muscle or bone deformities, release tight muscles, tendon lengthening, or stabilize joints. Educational and behavioral support. Children with CP may benefit from educational support tailored to their needs. Behavioral interventions and counseling can also be helpful for managing emotional and social challenges. Parent and caregiver support. Caregivers play a crucial role in supporting individuals with CP, Providing them with education, resources, and support networks can help improve the overall care and well-being of the individual.